The United States ranks last in among 11 of the highest income countries in the United States. This shows that the United States healthcare system is flawed and can really benefit from a shift to the universal healthcare system. The universal healthcare system can be an effective solution to our problem and lead to long-term sustained economic benefit. Within my coursework and free time, I have done ample research about the current private and public healthcare system around the world and in the United States. This research has allowed me to present today and make an effective solution to our current situation of healthcare. Many of us have dealt with private insurance or even government subsidized insurance programs, and we've encountered many difficulties. It's either extremely expensive or difficult to get. We have all needed to go to the doctor at some point, and so really by switching to a universal healthcare system, it'll make this whole process a lot simpler and easier. A universal healthcare system is the right choice in creating a more effective healthcare system in the United States. Within this presentation, I will go over the private healthcare system that we currently have, the universal healthcare system, and potential pros and cons of this universal healthcare system. To understand why we need a shift to a universal healthcare system, we must understand that the current system and its faults. The current healthcare system in the United States is private insurance. There are few options for low-income individuals to really gain the same level of insurance that private insurance holders have. It really requires people to have high incomes, and that really isn't feasible in the United States. This creates an even larger disparity within the income bracket, while with the higher income earners receiving much better benefits and being a lot healthier than the low income people. Having this great disparity has led to great economic impact. It really creates a strain on the current resources we have and has created many problems, not only for the people, but the system in place and offices. Our private insurance companies can include Blue Cross Blue Shield, Cigna, and many others, while government subsidized insurance can include Medicaid, Medicare, and others as well. These programs are really great and a great first step towards the universal healthcare system, but really by implementing the full universal healthcare system, I think would be much more beneficial. During the Obama era, he implemented the Affordable Care Act, which has helped improve the lives of many low-income citizens. The United States' current system of private healthcare would greatly benefit from the implementation of universal or public healthcare. Universal healthcare is defined as ensuring that all people have access needed to health services of sufficient quality by the World Health Organization. Many countries have already implemented the universal healthcare system, including many first world countries with populations maybe not as big but fairly large, and it has worked and really benefited their country and citizens overall. As you can see by the chart, the cost per capita of healthcare spending is significantly higher in the United States than other countries that are just as developed as the United States. So you really can see the strain that this creates on individuals here. In order to implement the universal healthcare system, we need to look at the structure, benefit levels, and extent of the coverage that we would want to apply. This can be implemented through increasing taxes, especially on the higher paying individuals. Moving on to the universal healthcare system addresses growing chronic disease crisis, mitigating costs and mitigates the cost of that said crisis. As more people get sick, they have to spend more money and put more restraint on these hospitals in order to sufficiently cure them. For example, obesity can really reduce productivity of a person, and this has led to significant impact in the amount of money a workplace can earn. In order to implement this system, there are a few risks. Significant upfront costs will be required. Many government-run agencies also encounter inefficiencies, as you know, kind of going to the DMV, seeing how long those wait times can be. But over time, these wait times will reduce as the system becomes more sustainable and as people get used to it. So overall, looking at the future benefits, it's encouraging a more sustainable preventative health practices for all citizens, not just the wealthy. It allows more people to be healthy, which overall will create a better place for all citizens. Universal healthcare benefits are necessary and require a long-term implementation plan to really mitigate these risks, as I mentioned. While the implementation of universal healthcare has great economic costs, the long-run positive impact can lead to an overall healthier population than the current system of healthcare. The United States should consider switching to a public healthcare system. Thank you for your time.